tell me the differences between the Moderna vaccine and the Pfizer vaccine? Because there are some differences besides the age range. So if you could highlight that age range, but also maybe the dosage, series of shots, what that looks like.
Yes. So I'll start with Moderna. Moderna vaccine for the 6-month to 5-year-old age group is a 2-shot series. So it would be 1 shot now and a second shot in about 4 weeks. It's about a quarter of the strength of an adult dose. The Pfizer vaccine, the approval that just came through is now for that 6-month to 4-year-old age range. We've had it available for 5 and up for a while. The Pfizer vaccine for this age group is a 3-shot series. The Pfizer vaccine for the 6-month to 4-year-old age group is a 3-shot series. So it's a shot now, a shot in 3 weeks, and then that 3rd shot will be 8 weeks or more after the second. So it's important for both vaccines that the series is completed to get the full effect and protection.
Great, thank you. The next question is that, we know the benefits of the COVID vaccine, but what should parents take into consideration before vaccinating their child? Are there any conditions or circumstances where it may not be appropriate to vaccinate at this time?
Really the only thing parents should pause and wait on is if their child is actively sick. So if your child has a fever or has really severe vomiting and diarrhea, if they're clearly ill, please wait until they feel better to get the COVID vaccine. There are no other contraindications at this time.
Thank you. Will I be able to mix and match vaccines for my young children? Because as we mentioned previously, they're different doses or different series.
At this time, we do not recommend mixing and matching. We want you to start one series and finish it. That may change as more information comes out over time and we learn more.
Thank you. Should my child get the vaccine even if he or she is maybe 5 months or not quite 6 months, but I really want to get my child vaccinated?
We know parents are anxious to get this protection for their children, but it's not approved for children less than 6 months old. So you have to wait until the 6-month age range to get the shot.
Great. And then my next question is, how important is it for children to finish their vaccine series? With the 2 dose or 3 doses, that can be a challenge for some parents. Can they just get maybe 1 and that's it? Or what do you recommend?
It's incredibly important that children receive the full series. Many of you may remember that Pfizer was looking for approvals in the winter and it got delayed. And a lot of that was because after the 2nd dose, there's really not very much protection still. It's that 3rd dose that gives full protection. So it's important for either series that the full course is received.
My child has already had COVID-19. Do you recommend the vaccine series?
The great news is if you've had COVID infection and you get the vaccine, your protection looks really good. So if your child has had COVID infection in the past, we still recommend COVID vaccine to help protect them and give them a little more information for their bodies in case of other variants and as things change. If your child currently has COVID infection, we do want you to wait until their symptoms have resolved to go get your COVID vaccine for them.
What can you tell me about the long-term effects of this vaccine? Should this be a concern for parents?
We don't have any concerns at this time for long-term effects from COVID vaccination. We've had a couple of years now, almost, of adult and a year or so of teenager protection, and we've not had any long-term effects that we worry about at this time. We always recommend, if you have any concerns, talk with your doctor.
Do you expect there to be booster shots made available for this age group in the future?
We do expect boosters. The FDA mentioned that, and it will certainly be part of the plan. We don't know the timing yet, and we'll be waiting on more information on that.
Thank you. Are you seeing an increase in COVID-19 cases in your pediatric patients? What's what's kind of the, where do we stand right now? Do you expect to see a surge maybe later this summer or when school begins? I know there's some variants floating around there.
Yeah, we had, the big Omicron surge definitely hit children harder. And now we just have kind of a slow, steady trickle of COVID. Many parents will know that COVID infection in children can look a lot of different ways. Many kids will get just cough and cold symptoms. We see a lot of croup and breathing problems in children with COVID, in the younger children, and then a lot of stomach upset, vomiting, diarrhea, and then obviously a lot of concern for hospitalization from long-term effects of COVID and MIS-C in some of our kiddos. So those are the things that we still continue to see some of. It's not in the big waves we saw before, but it's just a slow, steady trickle.
Great, thank you. Going to move on to some questions about, rollout logistics, those sort of things. What can you tell me about the timing of the rollout vaccine in this age group? When will Riley be ready to administer? Those sort of logistical questions.
Yes, so things that parents should know. Pharmacies do not administer shots in children less than 3. And so for a lot of our infants and young children, this is a shot that will be given at your doctor's office or through your health department. Please check the state health department website for updates as this all rolls out. The rileychildrens.org website will have information as well. Riley Primary Care at IU Health, we will be providing community-facing vaccine. We're waiting on the final approvals to go through this week and for the vaccine to arrive in our offices, and then we will be able to post information. We're hoping by next week that you'll be able to find information and scheduling on all of those websites.
Great, thank you. And just one more time, can you reiterate where parents can get their kids vaccinated and where they can go and beyond maybe their pediatrician's office?
Yes. Hold on, I'm going to give you one other. Okay. Parents can look for COVID vaccine at several sources. You can call 211. You can look to your local health department, your pediatrician or family physician, and the rileychildrens.org website will have information as well. And then the state Department of Health website. So all of those locations can be places to access vaccine. And for the older children, you can continue to look at pharmacies and other places in your community as well.
Great. So the next kind of batch of questions that we have kind of revolve around vaccine hesitancy. It's been reported that there are a low number of kids that have been vaccinated. And do you expect this to be the same result in the age group, these low vaccination rates?
There is a low vaccination rate for children. There is early on in the pandemic, this was certainly hitting the older age populations harder. That's changing over time. And COVID infection still causes long-term complications and death in children at a higher rate than most anything else that children get infected with. So it is a concern. And we do encourage parents to get their vaccine for their children to help protect them.
And so as a pediatrician, how do you help ease that concern of parents? And do you feel a responsibility, how to help reduce that vaccine hesitancy?
Yes. So our job is to make sure as your pediatrician and your family physician that you as parents feel comfortable with the vaccination process. And so we absolutely encourage people to call us or make an appointment to come in and talk about what vaccine might be best, what the safety concerns are that you may have. That's absolutely what we should be doing. A lot of parents have a lot of different questions, worries, hesitations. This is new for a lot of people, and so we welcome those questions, and please call your doctor and have a conversation if you have concerns.
Thank you. All right, so we have our last question, and that category is on the booster shots for kids. So can you give us some guidance on when do you recommend children receive booster vaccines? Booster
vaccines can be very confusing for everyone. The CDC does have a wonderful booster tool that you can go to where you put in what shots you've had and the timing, and then it tells you when you're due. We do expect boosters to be a routine part of COVID vaccination. So that will be a helpful tool depending on what brand you've gotten and where you're at in the vaccination process.
Hey there. Yeah, I have a question kind of related to what you were just talking about. We're talking about the state dashboard showing, less than 35% of Indiana children receiving the vaccine in our area. But why do you think those numbers are so low?
I think a lot of factors contribute to low vaccination rates in children. One is access and making sure that we have enough places for people to get vaccine. All credit to our health department and our county health departments and our pediatrics and family medicine offices for getting vaccine out there, but it's certainly been hard for parents to get to the doctor and get those things done. I do think that the perception early on that COVID was an infection and a worry for adults shifted the perspective so that our youngest children are seen as not as at risk when it comes to COVID infection. That changed with Omicron and it continues to evolve. And so we have to make sure we get the message out there that COVID infection is a concern for children. We hope your child gets through COVID in a very mild, cough and cold. That would be great. But we have to make sure that we give your kiddos some vaccine information and some protection in their bodies so that they're prepared if they get COVID infection, that it's mild and that they avoid hospitalization.
Well, should we expect to see similar vaccination rates for lower or for similar vaccination rates or even lower rates for younger children?
Everyone, it surprises me every time. So we're prepared and there's plenty of vaccine supply for every family that wants it. We hope that the rates will be higher and we'll have to see.
Well, as I know you guys are having to fight that misconception. So even as kids are getting ready to head back to school again, should that low vaccination rate be a concern to other Hoosiers or even other parents?
Any parent or employer or coworker who's watched families try to navigate daycare and school and work should understand that COVID vaccination for this younger age group is going to help them all. I cannot emphasize enough, and I know we've all seen it, the stress for parents of young children of daycares having to close or their children being sent home for days on end. If we can get this younger age group vaccinated, those things will get better. And so I'm hopeful. It's really important as we go back to school in the fall and there's, continued COVID. Commonly infections increase as children are in groups. And so back to full time, we expect more COVID infection. So I'm hopeful that parents will prepare their kiddos and themselves with COVID vaccination before the fall.
And this is my last question, more of a request. I know you gave some differences in how younger kids get the vaccine and older kids, because pharmacies and such are not doing that. Repeat that information for us one more time, please.
Yes. So for younger children under age 3, pharmacies will not be vaccinating that age group. And so that age group, you'll need to look to pediatrics offices, family medicine offices, and your local health departments. And then Riley will be offering community-facing COVID vaccine so that anyone can schedule there as well. We're just waiting on the final approvals before we can put schedules out.
Awesome. Thank you.
You're welcome. Yes.
Okay. Yeah, basically just essentially why now in like the last 2 years, it was approved for, it's essentially kind of gone down in age, how it was approved for the older people first, and then eventually got more towards, middle-aged people in their 20s, and just last year, people in their teens. And like now it's for children, these young. So essentially why now, like, has anything changed to allow for this?
Yes. A lot of the work that the vaccine research was doing was looking at dosing. So clearly the biggest need at the beginning of COVID was adult vaccination and protection, right? Because that's where we saw the most hospitalizations and deaths. And so now they've had some time to look at the dosing for children and figure out what's the lowest dose that's safe to give that will provide protection. And so that took some time. And that's why it has finally now come through, but has taken a while.
Got it. And will this lower dose still provide the same protection?
Great question. Let me. figure out how to answer that the best way. The doses on Pfizer and Moderna are different. Both appear to provide good protection. So I want to encourage families that the best vaccine is the one you have access to. And then if you have questions about which one to choose, please ask your doctor for more information.